Time that we set aside a little bit of time to chat with members of the medical community today. No difference there. We're going to bring in Dr. Jack Ramage, a gastroenterologist out of New Hanover Regional Medical Center. And you're here during the month of March, with there's a month we were just talking off camera that could be a little bit busy for you, National Colorectal Cancer Month. Talk to me a little bit about the people or the persons that are in that age group that this could be something that they need to consider.
Well, colorectal cancer is something that tends to occur after age 50, and the older you get, the more common colon cancer is, as well as colon polyps. Colon cancer has traditionally been the second leading cause of cancer death, and this month is awareness for screening techniques to help decrease the rate of colon cancer. What's happened over the last few years, we've actually been able to bring colon cancer from the second leading cause of cancer death to the third leading cause. So we've made great progress in colon cancer prevention.
I know, I'm a man in my mid-40s, and when I go for my routine physical, I know that it's getting close to that time where I have to consider having that screening.
So colonoscopy or colon cancer screening of some technique is recommended to be part of routine health care for anyone age 50 or greater. If you have a family history, meaning mom, dad, sister, brother, or a secondary relative with a history of colon cancer, or in some cases colon polyps, we can start colon cancer screening at age 40 or sometimes even younger. So it's part of routine health care, and then as you get age 60 or greater, the risk of polyps or colon cancer increases to another level, and so it becomes that much more important.
Now, you said we've seen a drop in the number of deaths. Is that because people now are so much more aware of the screening process?
Part of it's awareness, but I would say it's earlier detection and removal of polyps. We know colon cancer typically develops from polyps, and so there's a cycle, and we have a chance to do a colonoscopy to remove the polyps and prevent colon cancer, similar to seeing an abnormality in your skin and removing it and preventing a skin cancer. We still have a long ways to go as far as colon cancer awareness. We know as far as the percentage of people that are eligible for screening or should be screened, only about half are screened.
And why is that? I was going to say, for people that are out there thinking it's something that I don't need to worry about, what would you say to them to encourage them to have these screenings?
Well, one, I think there's a lot of myths out there. One is that colon cancer, if you have that or you have polyps, you'll have some type of symptoms. And that's not true. The colon cancer is kind of known as the silent killer. So you don't necessarily have a change in your stool or bleeding or constipation or abdominal pain. Number two is it's a simple procedure. These days, in the last few years, sedation methods have changed, so when you have a colonoscopy, it's completely painless. I think there's that's another myth that people, or preconception that it's going to be an uncomfortable procedure. Also in the past, the prep for a colonoscopy was particularly unpleasant, and that's, again, something that's changed over the last few years. It's not something you're going to do for fun, but it's very tolerable. And then I think the most important thing is, one, it can prevent colon cancer, but two, if you have a normal exam, this is something you only have to do once every 10 years if you're at average risk. And
I always tell people, if you have questions about this, you don't want to contact me at the station, don't call or email me. You always want to check with your physician if you have any questions about what Dr. Ramage is talking about. Doctor, I appreciate the time.
Thank you.
Colin, what you got?